I would like to express my deep gratitude, and I'm very thankful to all of you that I have the chance to be here. This hospitality, this kindness of all the people here. We had so many meetings and chatting and discussing outside. It's a great, great honor for me to be here. And there was a big surprise a few minutes ago that someone came to me. It was actually Professor Lobner, and opened a bag, and there was a painting from myself in it. And I was totally surprised, positively shocked. So thank you very much. It was very, very kind for you. Thank you that I have the chance to be here. And now I would like to shock you, because I would like to discuss with you aspects of digitalization. And I actually would like to motivate you and would discuss with you that I deeply believe that smart health, that digitalization, that M-health is a disruptive change if we talk about diabetes care. And there's maybe one or two and say, oh God, oh, this is dangerous for us, and we are physicians and we don't want that apps are treating our patient. But I would like to motivate you that digitalization in our hand can be a brilliant tool to reach more for our patient than what we have done in the past. If we are honest, our work is mostly related to diagnosing lab parameter, diagnosing a disease, prescribing drugs, prescribing diagnostic or treatment. But what we are often missing is the component of our patient. We know that we can educate the patient. We know how difficult lifestyle change for prevention is, but the most powerful diabetes treatment is a lifestyle change of our patient. And this is a target, if we talk about digitalization, where I see a brilliant option using digital tools. And this is actually everything what I wanted to do in my talk. So we now can go ahead. But let me try to argue a little bit. And why I'm doing this? We founded the European Diabetes Forum. And this is a unification of patient organizations in the diabetes sector in Europe, of professional organization, but also of the industry. So the European Diabetes Forum works with the European Commission. So it's basically our big government in Europe, and develops guidelines, or not medical guidelines, but develops rules, legislation, certification criteria for everything, basically, and also in the future for digital tools. So if you're not thinking about an app anymore, like an app coming from the Play Store or from the App Store, thinking about an app as a digital therapeutic or a digiceutical, then such apps have to undergo the same licensing criteria like a drug. And currently, this is the situation in Germany and in many other European countries. And this provides a very interesting options. There are tons of applicabilities for digital tools, like it is written here. And the most important, I would say, that apps can track many things, but social activities, daily behaviors is something where apps are basically brilliant in tracking what the patient is doing. And also the aspect what the apps can do in point of care, motivational intervention, and having a direct access to the patient. Is this something what is a tool for us? We will see. There are also I think it's very difficult to read. I just see here. There also are challenges if you talk about digital tools. How can we prescribe this? How can we use this? What patients are using digital tools? Because it wouldn't be wrong to think that if you have an app for diabetes care, every patient is happy about it. In Germany, the data are about 35 to 40% of the patients are prone to use a digital tool, have the digital literacy to use the digital tools. Interestingly, these are not the young patient. Interestingly, these are the old patients above 65 years of age. We are totally surprised by this. But if you look into your iPhone, you probably have 300 to 400 apps installed. A woman at the age of 66 maybe has 50. So a health app on their phone has more space than a health app for a young person. There are in Europe a lot of data safety issues for using digital tools. There are regulations, what kind of data safety criteria you have to fill. But one other big question is how to integrate app into our medical management, disease management processes, how to prescribe, how to use the data, and so on. This is all challenges we have to address in the future. But there are big opportunities. If we have the chance to use a mobile tool, we are very close to our patient. Yeah? And this provides a new opportunity if you think about self-management and motivation of our patient, to empower patients for better self-management and decision-making. So this is something completely different than if you are talking about prescribing a drug. It's related to adherence, it's related to compliance, but it's related to many other tools in terms of self-management and motivational aspects as well. And using these digital tools can help us to better diagnose, to better monitor, and to better treat our patient. But what is needed? It's not needed that we only have a physician. It needs some information for the patient, and this is a very rational information, but it needs, I would say, about 80% motivation that the patient says, okay, this is something I like to deal with, this is cool, and I like to use this tool. And it needs some behavioral aspect because it's at the end targeting behavior, the behavior of the patient. If we now think about digital tools, and then we may say, we see it like this. If you ask a patient, he has a totally different view on it. So there's the user view of the patient or the non-diabetic person onto such an app. Then our view as healthcare provider or the patient who sees, again, totally different, but also the peer group. If we think about digital tools will help to establish social support or social integration, this is relevant. Then how can this access behavior, preferences, treatment aspects, and many other dimensions we may not know yet? This leads us to the point, if we want to apply a digital tool, we have to understand our patient. This is a review analyzing what is evidence-based in terms of prevention of diabetes. So all the aspects you can read there are points which are related to sustainable behavior change or maintaining a behavior change. If we look at what is written, especially the things which are here written in bold, all these are aspects which are related to our daily routine as a patient or even as a layperson. And what is written there, what is relevant for behavior change, is social support and frequency of contact. So as more contact you have in a certain delivery channel, and as more social support you have, as better the patient can maintain behavior change. How does behavior change works? There is a model which was developed about 11 years ago from a large European consortium, behavior change for patients with diabetes. This is a theoretical background here, but there are 3 phases: motivation, action, and maintenance. If you look at this, again, it's related to daily routine of our patient. And it's the behavior change, because when are we changing our patient? It's the behavior change. How to do behavior change? There are techniques relevant, like motivational interviewing, reflective listening, change talk. We all have here these techniques, and if we apply these techniques with the goal that our patient is adjusting his behavior, again, it's daily routine, how to use these techniques and how to address with these techniques the daily routine of our patient. Going ahead, looking what is driving our patient to change behavior. Imagine if you have a patient who has pneumonia or cancer. If this patient is talking to us, he's trusting us what we are telling him. The relevance of quality of life in this moment is not relevant, not so much relevant, because we have to do a surgery very soon in the cancer patient, and so the patient follows our advice. But if you talk about diabetes and obesity, we as physicians are out of the game to decide about the lifestyle of the patient, because there are others who are more relevant, and this is the peer group of the patient. So that means I always argue and say that the patient talking to other patients while he is waiting in the waiting room in front of my office, this talking is more relevant for his lifestyle than talking to me. Because we as physicians, if we talk to the patient, it works for about 1.5 to 2 days. Then the peer group of the patient is more relevant. And we all experience this. Yeah, the life in our family, the life with our friends is for our lifestyle more relevant than as I apologize, stupid physician telling us we have to change our lifestyle. Yeah, of course, the patient says they understand and so on, but the behavior change is more difficult. And this is the fuel for behavior change. And what is driving a behavior change? This is purely quality of life. So if we want to change our behavior, we want to see within 1 to 2 days that our quality of life increases. Otherwise, we will not follow a different behavior. Is this relevant for the use of app? Of course, because it's again, daily routine, it's quality of life. So if we want to think about good apps and good strategies in using apps, they have to address all this. Let's go ahead and let's look at type 1 diabetes patient. And here's written down how often they have to measure blood sugar, how often they have to decide about adjusting insulin or using drugs and so on. So that means basically the therapy of type 1 diabetes is fully 365 days in the hand of the patient. And there are few visits with the physician. So who is actually honestly treating the type 1 diabetes? It's not us, it's the patient. It's the patient self-management, what is powerful for type 1 treatment. Again, we jump into daily routine behavior and self-management aspect. And then finally, I showed you a slide yesterday. This is the healthy individual managing or having no elevation in the blood sugar because she's very insulin sensitive. And here is the father. And if we see this glucose elevation in the father was very insulin resistant, is not having diabetes yet, again, we see a very good mirror of the daily routine of this patient. And imagine, I jump once back, what happens here? Yeah? Actually, here is something what is an educational motive, because he's doing something what leads to hyperglycemia. He's doing again something leading to hyperglycemia. Here is doing something leading to hypoglycemia. So we could track or could use this information to track educational motives for the patient and the daily routine, on the daily behavior. And I think this can be very powerful for our patient. And now let's jump what we should do. And let's look at the date. Yeah, it's 2019. And this is our guideline, ASD and ADA. And it says we as healthcare professionals should be knowledgeable about digital health apps and the strengths and weaknesses, should support and inform our patients how to use digital health apps and use them for diabetes management. And we should use the data to improve quality of life and health outcomes. And I had just had a discussion outside and said, okay, it's so difficult to have a registry or tracking or the data of our patients. Yeah, many of our patients or many patients may use this information, but we don't have access. We don't use them. Can we change this? Can we make this powerful in our hands? And I apologize for this nice English slide, but I don't want to talk with you about what is written here. I want to look with you at this slide. This is a review we have done. We analyzed 3,500, or actually more than 3,500 articles, and it looks like into the A1C reduction by the use of digital tools. And you find the numbers here, and these are not single studies. You see the number of studies for duration of diabetes, duration of use of digital tools, how the features of digital tools, well, the age of the patient, the A1C, and so on, the duration of the disease, and so on. And there are A1C reductions from up to 1 or from 0.3 up to 1.8 A1C%. So it's like insulination of the patient. And if you look into the patient clientele where it was most effective, shorter duration of the disease, younger age, or as a short duration of the use of the app, 3 to 12 months, and a duration of diabetes less than 7 years. So there's a specific clientele susceptible for the use of the app. What does it mean for us? Again, it's daily routine for our patient. All these features written down here means it's what the patient is doing on the daily level or routine. Let's now look into the A1C reduction I just have presented. Here you see our oral drugs, how they can use lower A1C, and how lifestyle can lower A1C. Of course, lifestyle is the most or the best and effective anti-diabetic drug or anti-diabetic intervention. And here you see now the results of digital tools. Digital tools developed until 2010, 15, and 20. And you see there's a big reduction of A1C for younger digital tools. And these are apps on smartphones. And now you could say, okay, how can we explain this? How can a stupid app on a smartphone lower A1C? It's impossible. No, it is not. Because what we actually see here is the column we see here. The smartphone is not treating A1C. The smartphone is tracking the lifestyle of the user and giving at the right moment the right impulse to change something. And we are deciding about 1,800 times every day about what we are doing. There are about 430 to 450 decisions per day related to our lifestyle relevant for diabetes. So now imagine from this 450 or 400 decisions, you can influence only 15 or 20, but you do it every day over the period of 1 year. This means about 8 kilogram weight reduction. So the strength, the power of using digital tools is not that they treat a disease. The power is that they have the potential to influence our lifestyle. And this is the ultimate goal for diabetes prevention, is the ultimate goal for effective management of our diabetes patient. So my answer why this is successful is at the end this picture, because we are in the pocket of our patients. We never have been so close to our patient and not so continuously close to our patient as being in the pocket of our patient. And we are in the middle of their social support, in their social environment, in their social peer group. And if we are now clever and say, okay, we use this place to then we have a success story for digital tools. That's why from my side, a clear yes. The digitalization will be disruptive for many things what we are doing in the diabetes sector. But if we place it in our hands, if we use it in our hands, then it can become a very powerful tool for our patient. So to come to an end, this were all the aspects the patient has, or I have mentioned in the daily routine of our patient. And I argue that the daily routine of our patient addressing this aspect is the target for the use of digital aspects. And we have asked about 1,500 patients what they would like to see in the use of digital tools, and these were their answers. So they answered in German, but I translated it into English. These are things where the patient is saying, this is important for me in using a digital tool. And if we come back to this behavior change model I have showed you a few minutes ago, and we try to adjust this on the aspect of motivation, action, and maintenance, are these the features the patient are looking for the use of digital tools in the diabetes sector. And if you look at this, it makes sense. Yeah? It's not difficult. These are basic things we say it's relevant for self-management of diabetes. If you look into the different kinds of disease, prevention, type 2, type 1 diabetes, these are the aspects the patient would like to see for a digital supported behavior change. And look into very individual aspects or preferences, health-related patient aspects, if they have a hypoglycemia or hyperglycemia tracked by a sensor, an educational video, what they can do, for example, walking 3,000 steps to lower the blood sugar. And finally, to give you an example, in Germany, we have these tools already available. They're called DIGAs for digital health applications. And there are 5 diabetes DIGAs. One is called Zanadio. It's an app licensed like a drug, reimbursed by the health system. Only physicians are allowed to prescribe this to treat obesity. So the patients are treated by the app for 3 to 12 months for obesity treatment. This Impera is a type 1 diabetes data usage app where the patient is getting a feedback about the quality of his diabetes care, and the physician can access this directly. So patient and physician similarly have access to it. Oviva is also an obesity treatment app. Vitadio is a type 2 diabetes artificial intelligence based app the patient is making a photo from his dish, and he's not getting blamed what he's just eating, but he gets a recommendation how to change the next dish. And the patient loves this a lot because there's no stigmatization. MEBIX is a digital disease management app between physicians and patient. SEDEA Mellitus is one we are developing, focusing on physical activity. And here you see how patients are increasing physical activity and A1C is going down. And Hello Better is a depression treatment health application, actually working better for depression treatment than talking to a psychologist. And this is totally in diabetes patient. And finally, the European Diabetes Forum has taken this challenge, and we developed recommendations how to develop these digital tools. And it means first, it has to be user-centered, addressing all this aspect here. So at the end, the patient is the developer of this digital tool. And we have to ask.
To give him more time, please.
We have to ask the patient basically to decide how to develop this app. Secondly, we have to develop best practice model. That means disease management model, how to implement it in our care processes. And finally, to integrate it into a digital diabetes health ecosystem, so that the app, the physician, the behavior of the patient, and the payer structures go hand in hand, finally with the goal to improve the outcome of our patient. Don't forget this number. Without any app, without any physician, without anything, what we can do, what our patient can do is walking 10,000 steps every day, because this will keep you healthy and will prevent diabetes. And let's use digitalization at the end to help us and our patient to walk away from diabetes. Shukran.
Shukran.